We're going to actually demonstrate a different technology. We were waiting for you guys, so we have a different case, and then we'll have our carotid ready. But we have a new technology that's going to help, I think, with osteoballooning. And we have a patient with a twice instant restenosis of a renal. We're going to use a different technology, actually two different technologies to treat this. So I'm going to direct you to my hands. This is called the flash balloon. You know, we've always had problems with the ostium of the renal arteries, trying to make sure we're right there and to get it nice and opened up and everything. And this is going to be a balloon that's helped mold at the ostium. So if you can see this, Josh. That was just me being not a good tech. So we'll watch this go up nice and slow. But look at that. That's awesome.
What size does that get
up to? I'm telling you guys, every time I see it, this can go up to a 12. The 7s will go up to a 14. Now, you could flare this all the way against the aorta. I just want to get the ostium nice and opened up. It helps if we ever have to come back. I'm going to come down on mine now. And then I'm going to have Pam come down on hers. Okay.
Looks like that is so large, you have to keep your eye on the contralateral stent.
But look, can you guys, can you see that? How well that's up against the aortic wall?
Take a single
awesome.
shot there.
Or mag up one?
I'm going to take a shot. I just want to get this balloon out because it wings a significant amount. And then I'll give you what I want to see too. Whoops. But not my bad technique. There you go. All right, we're going to take a picture here. Honey, hold your breath. That is awesome. I'm going to angle out and see if that just shows it better.
Gary, what would you think about some IVUS just to show us what that looks like?
You know what? If they're not ready in the other room, I will. I know they had a patient waiting, Josh.
Okay.
We're checking on it. Can you guys get me an IVUS catheter, though? If you guys, I mean, what's interesting is I was working on this with this on the bench top because I had not done a stent graft before. I've only done, they're ready, I'm sorry. I'll take it and we'll get it to you, and maybe I'll ship a picture for tomorrow morning's check-in. But can you guys go up to 10-inch? I'm gonna magnify that up just so you guys can see it better. Can you see that now? Is that better?
Yes.
That looks
You can
great.
really see how well that. And what's really interesting is look at the one next to it. I oversized the balloon to dilate the osteo area on the right one because I didn't have this balloon available to me yet. And look at the difference. I mean, I think that's really cool.
Yeah, that's going to be so helpful if you ever have to re-angio this. The catheter is going to be much more likely to slip right in.
Just gonna, yeah.
Well, as I said, for fenestrated stent grafts, too, when we're trying to flare that and potentially get a seal there, it'll be invaluable.
Right. Yeah. I think because you'll be able to mold right at the ostium of that and get everything up against the walls. And it just takes what we're doing to a much different level.
The other point Mark made was
that's why it's so hard
pushing on the other stent.
So hard to do the research on these things because technology just changes so fast. You know, but I'll tell you, it's great. Well, we're going to go to the other room. They've got a nice carotid that they're going to show you there, and we'll kind of go from there, okay?
Thanks, Gary. That was great.
A couple minutes to review